I'm really sorry. So I thought I'd go back home.
Okay. Mark's going to press my...
Hello, everybody.
Hey.
Hello, hello, hello. Well, good evening and welcome to Policy Idol 2024. Yes, you are the lucky one, granted one of the golden tickets to the glittering wonk fest that is Policy Idol here at King's College. The word that comes to mind, perhaps, is prestigious. Prestigious. But of course, that would be quite the wrong word, because there's nothing prestigious about Policy Idol. Prestigious comes, as you all know, from the Latin prestigiosis, which means deceitful, delusional, full of tricks. Policy Idol is the opposite of that. So not, well, hold on. There's another definition of prestigious, which relates to feats of juggling, being able to keep lots of balls in the air at the same time, spinning plates, achieving a feat that requires balance and judgment and skill. And that's exactly what we are demanding of our contestants tonight. So welcome to the prestigious event here that is Policy Idol, a chance to honour those who have found a way to balance all the competing pressures and demands, to conjure a practical policy which seeks to solve one of society's wicked issues. Regulars will know that in return for the fine wines and a range of canapes/tapas served in an atmosphere which might be described as 1980s school disco, we demand, ladies and gentlemen, we demand whooping and hollering, noisy appreciation of policy prestigiosis. So let's practice a bit of whooping and hollering now. On the count of three. 1, 2, 3. Hey, come on! That's enough. Save yourselves a bit. We're going to have a bit of that later on. My name is Mark Easton. I should have said that earlier. I'll be your host for tonight's Policy Idol extravaganza. And I've actually been standing here for the previous 9. Yes, Policy Idol is celebrating its 10th anniversary. Whoop, yes! Very, very special night. I'm going to explain the rules and all that stuff in a moment. But before that, it's my great pleasure to introduce this special year's amazing judging panel, featuring, as ever, some of the finest policy minds in the wonky universe. We have, when I say your name, if you could just wave so that people know which one it is, just in case there's any confusion. We have Dame Louise Casey, who likes nothing more than tackling the most difficult policy challenges in the country. Has been numerous prime ministers' go-to policy idol. There's barely an institution or an issue that's not felt Louise's unwavering gaze and read her fearless analysis and criticism. And her BBC Radio 4 series, Fixing Britain with Louise Casey, mandatory listening for anyone serious about UK policy. We have Polly Toynbee! Polly has been a columnist at The Guardian for more than a quarter of a century, where her influence on UK policy debate has been substantial. She is president, I believe, of the Social Policy Association. It's got the word policy in the title, you must be an expert, and has been a trenchant critic of successive governments. Boris Johnson described her as the high priestess of political correctness. She described him as... Okay, well, you can guess. I'll leave it. Our third judge, David Halpern. David Halpern, ladies and gentlemen. David is Britain's nudger-in-chief, chief executive of the Behavioural Insights team. Since it was established back in 2010, David's provided evidence for what actually works in the policy sphere, which is a quite handy thing to know. Before that, David was chief analyst in Tony Blair's strategy unit in Number 10, and more recently was a contributor to SAGE, the advisory group responding to COVID. And our final member of the quartet of judges, Bobby Duffy, ladies and gentlemen. Yep, there he is. The man himself, Professor of Public Policy and Director of the Policy Institute here at King's. He's worked across most public policy areas in his career, including being seconded to the Prime Minister's Strategy Unit. Did you ever cross over? No, you didn't. And he likes nothing better than writing books telling people how wrong we are. So there we are, Bobby Duffy. Ladies and gentlemen, your judges. So that's the judging panel, but they aren't the only judges, because anyone who's been to this event before will know that you, our esteemed audience, will also have your say. After we've heard from all 7, that's how many we have this year, of tonight's Policy Idol wannabes, I'll invite you to go online via the web link. Have you got a web link? Or QR code or something? Yes, good. And then you from there you can select and vote for your favourite policy idol. The presentation with the most votes from you will win the prestigious audience prize. Okay, as promised, a quick reminder of the format. Each idol contender, each pitch, that will actually pitch their policy idea against the clock. It's a bit like the Gong Show. They have precisely 3 minutes to convince the judges, who will mark their presentation on substance and on style. How well did they marshal the evidence to support their policy idea? How well would it work, and how well did they sell it? They have 3 minutes, as I say. So you go under, and that's wasted seconds. Go over, and the judges may deduct marks. My assistant, Emiliana, here. Just stand up, Emiliana, if you would. And round of applause, Emiliana. Emiliana's in charge of the whistle. Can you just give a little blast on your whistle? Yep, that is the terrifying noise that tells the contestants that they have reached the 3-minute mark. If they're still going at 3.5 minutes, a trapdoor, you can't see it here, but there's a trapdoor up here, and that'll open up, and they will literally fall into a huge vat of ignominy and humiliation, which is under the floor here. So the stakes are clearly very, very high. There are 4 prizes, as I explained. One for presentation, one for the presentation with the greatest substance, another with the greatest style, your audience prize, and last but not least, of course, our Policy Idol 2024! Yes! Thank you. I can see you're getting a bit weary of the whooping and hollering. I have to build it up again for later on. Right, time now for our first presentation. I'd like you to welcome to the stage Rinali Nide, who is doing immunology and microbial science research and is going to talk to us about enhancing health literacy. Right. There we are. Rinali, you have precisely 3 minutes, starting now.
75% of people across Europe lack the ability to understand basic health information. Closer to home, in England, up to 60% of people have limited health literacy skills. So, for example, in Southwark and Lambeth, where I currently work, 40% of people have poor health literacy. In Lancashire, in the north of England, where I grew up, this rises to 50%. So why does this matter? Well, limited health literacy skills cost the NHS approximately £3 to £5 billion per year, and people with limited health literacy are up to 3 times more likely to be hospitalised, have depression, or have an early death. So, what is health literacy? Health literacy is the ability of an individual to gain access to, understand, and use that information to promote good health. It's more than simply being able to understand leaflets or food labels. So, to tackle the health literacy crisis, I propose a 3-pronged strategy encompassing education, access, and empowerment in order to equip individuals with the resources they need to be able to make informed healthcare decisions. So firstly, education. Health literacy should be introduced from an early age and continue into adulthood with the help of public awareness campaigns. For example, posters on the tube networks and also disseminating information in local community areas such as gyms. Access. So, working with the local communities of Southwark and Lambeth, we will identify the local health needs and also assess engagement with existing programs, such as Health Watch. Then, working together with this diverse population, we will co-design materials and resources which are culturally sensitive and also suitable for the diverse needs of the population, including those with disabilities and also digital resources. We will also equip volunteers to be able to help the local population according to their local needs. And finally, empowerment. So, with this program, individuals will feel empowered to be able to have conversations with their healthcare provider. Continuing professional development programs will also be provided to healthcare professionals on health literacy and communication strategies to enable them to be able to have these conversations with people of varying health literacy levels. So this policy not only aims to tackle the current health literacy crisis, but also aims to address public health outcomes. The impact is wide-ranging, but includes better medication adherence, better doctor-patient relationships, improvement of social and healthcare disparities, fewer days off sick, better management of chronic diseases, and fewer healthcare costs. This policy therefore addresses health literacy, public health outcomes, and overall aims to reduce the social and healthcare disparities in our local community. Thank you.
Very good. Excellent. It's going first is always an added drama, so well done. Thank you very much. And you're pretty good on the time. I'd say, what, sort of 10 seconds maybe over? Nothing too much to worry about. Now, who'd like to ask Renali? Yes, Polly.
If these people are not accessing at the moment information that's available, how do you get them to participate in this? I can see the education because you've got them captive, but what about the others? How do you get people in?
Absolutely. So this has been a recurrent problem. So health literacy is not a new problem. The figures I mentioned are from 2014, actually, so they're now 10 years old, and nothing new has been done since then, in the UK at least. So health literacy interventions have failed in a lot of areas thus far because they're done at a sort of bird's eye view level. What I'm proposing is that we actually go into those communities, talk to people, identify their health needs. So an easy way to do this would be, so if I take Southwark and Lambeth as an example, very culturally diverse, could go into sort of mosques and churches, but also gyms, pubs, local areas. There are examples that this has been done in other countries as well, which I can expand on. And they do work. And so that would be the key way to enable access.
Yes.
Yeah, just a bit of clarification. That was brilliant. Thank you very much. Great slides, really clear story, really clear benefits. Can I just clarify, just sort of like factually, are you talking about starting in Lambeth as an exemplar and then trying to roll it out, or is the idea that you do it nationally but as a very local base, or what's your thinking?
So again, health literacy strategies, sometimes they're sort of done on a more global level in terms of countrywide. What I'm proposing is, yes, Southwark and Lambeth first, because I gave the example of Southwark and Lambeth and Lancashire, where I'm from. Those two populations are not the same. So I'm saying that we identify the local needs of the population first, and then use that model, and then expand it across the UK.
Great, thank you.
Any more questions? Yes, David.
Just to check, so look, it's great. One argument might be, it's all very well to drive up literacy, but it's the legibility. We live in an environment which is hard to live healthily. Would we be better off running the campaigns to make it easier to get healthy food or restrict smoking? Or
So actually, some strategies like that already exist. They're within the PSHE curriculum. I purposely avoided talking about school curriculums here because that's already very overloaded and we can't put more on teachers. But for example, the traffic light system or the imaging that's put on tobacco packets now, those are World Health Organization health literacy campaigns. That's where they stemmed from. So they're already being done, but certainly there is room for improvement in those areas.
All done. Excellent. Renali, that was absolutely excellent. Thank you very much to our first idol participant. Thank you very much, Renali Day. can I just advise you, just maybe make a note now, because it'll all rush by, because you will have to do a vote later. Perhaps think about what kind of marks you're going to give that one, and then you can look that for your audience vote later on. Right, time for our second couple this time. Talking about helping students choose what they learn. Please welcome AJ Oppenheimer and Kiara Lee. Oh, I need to start you off, don't I? Yeah. Hold on. You have 3 minutes, starting now.
How many of you have ever been sitting in a room thinking, what am I doing here? That's what half of 15-year-old UK students were thinking while they were sitting in schools today. Students are bored in schools because they do not find what they're learning interesting or relevant, and they aren't given any agency to change this. In fact, 2 out of every 3 14-year-old student in the UK said that they believe what they're learning will be useless for their future. At the same time, teachers are being sucked dry of their passion for teaching because they are not given the freedom to creatively and independently teach. The UK curriculum is a straitjacket, not a support system.
Student boredom impacts more than just students' grades. It also impacts their overall happiness. We see that engaged students are 2.5 times more likely to say that they get excellent grades, and are 4.5 times more likely to say that they're hopeful about their future.
And giving teachers a bit more autonomy has a strong, positive, and suggestive correlation to making them happier in their work and making them say that they are more likely to stay in teaching for the long term. So our policy helps both students and teachers.
So let's help students learn to love learning. That's what our policy does, Student Engagement Week. We would have schools set out a survey for students to do internally so that they can give feedback to their teachers and their administrators on what they want to see improved in their curriculum today. So this would be promoted using student leadership programs, which already exist, great thing, and then we would give teachers about a month with administrators on the side also helping to go through this feedback and create ideas and help implement them in the classroom when they think they'll be successful. Taking these ideas, we would have them implemented in the classroom, and then if certain ideas get really positive feedback, we want to see those referred to policymakers so that they can work with the Department of Education to implement these ideas and continue this Student Engagement Week for a designated week within the curriculum.
Giving students a chance to have their say during this designated Student Engagement Week has 3 benefits. It increases teacher and student enjoyment, it makes students more politically engaged, and it promotes local culture. By giving students the chance to learn things that they find fun and interesting, we're making them enjoy classes more. And by giving teachers a break from the monotony of the standardized curriculum, we're reinvigorating their love for teaching, which creates a happy classroom for everybody.
So clearly, we care about political engagement. So that's what we want to do for students in schools today. We actually have research that shows that when students are involved in the small-scale democratic process and see their opinions put into policy, that this actually increases their overall political engagement in their future.
Last, this program will promote local culture by allowing students to bring in parts of their own community or culture into the classroom that they would like to learn, such as learning more about the Windrush generation or local farming practices. This is important as 3/4 of UK secondary school students said that they do not believe that the UK curriculum represents them or their lived experiences.
So our solution is cheap, simple, easy, and fast. Let's help students learn to love learning. Vote student engagement.
Very good. Well, very, very impressive. We've had, I must say, the standard this year so far has been absolutely right up there. So well done. I'm sure our judges will have some questions for you. Who'd like to start us off? Yeah, Bobby, and then we'll go to Eve.
No, brilliant. Another brilliant presentation. Such a brilliant story, well told, using the data and transitioning between different parts of the story. Absolutely excellent. And I've got sort of 2 reflections from very different types of spheres. My 15-year-old daughter would very much agree with you about the boredom. That is very, very true. But then also at a more policy level, one of our visiting professors is Joe Johnson, who's just written a House of Law, well, helped run a commission on school-age education in the UK and came to very similar conclusions about the restrictions and the boredom that brings for both teachers and students. A really important issue. I guess the point the question goes to, not dissimilar to the previous presentation, about changing the curriculum is an incredibly difficult thing to do, and people struggle to get that type of change. What's your approach to being able to overcome that really terrible hurdle?
Yeah, so we have 2 points on this. The first is that everybody agrees that a school curriculum needs to be evidence-based, right? Every single part of it needs to be evidence-based. And this program has an incredible amount of evidence to back up its effectiveness. So that would be kind of our starting pitch to any policymakers. We've also done a lot of research on the political feasibility of this. We can see that the House of Lords has called for a curriculum to be more creative and independent. We can see that there is an incredibly successful case study of an NGO called Votes for Schools. They're doing something a little bit different, where they create the curriculum and then they ask students to vote on the success. So our idea is still unique, but it paints kind of a picture of this idea, and it's incredibly successful. It's had 52,000 votes just this week, and it's implemented across 1,500 schools. We can also see that the Association of School and College Leaders is in favor of something like this, saying that they need to customize the curriculum to young people in the area. So we have a lot of evidence that that things like this are already being called for by students, teachers, and even policymakers themselves. So we think that we'll be able to kind of follow up on that and to emphasize how practical and how simple and easy and even cheap this program is, and to make it more feasible for the government.
Brilliant answer. Thank you very much. It's almost like you anticipated that. Very good.
It's a good trick, isn't it? I think I've got some slides.
Just out of my pocket. No big deal.
Yes, nothing like good preparation. Thank you very much. Look, I'm going to ask a slightly tougher question. I suppose, of course, at some level, if people choose subjects or choose things they want to be involved with, they're much more likely to want to therefore take part and make a better job of it. The same way I noted for one of the slides that you put forward is listening to what young people want and then doing it are two different things, incidentally. People often say, we'll listen and then we'll do, and then they don't. I guess, how do you square this off with the fact that some things when you're 12 just aren't interesting, and yet we need as a society to actually get shit done? And therefore we actually, we do, and some stuff isn't necessarily trendy and cool, and yet without it, the whole of society would collapse. And so we have to find a way, not just to listen to what people want, but to know what we as a society need and back that into the system in the most exciting way possible, which doesn't, necessarily play to the model, perhaps, that you're suggesting.
Absolutely. Well, I think I'm going to talk a little bit.
You knew I was going to ask that question, so
I'll pass it off to AJ to finish it off, because he's got lovely statistics.
No, you do it. You finish it. Go for it.
Well, what I wanted to say was that no one's suggesting that we cut off unnecessary parts of the curriculum or necessary parts of the curriculum. We're not changing it as a whole. What we want to do is adapt the way that it's presented and talk to students where they're coming from. I think this idea that, 11-year-olds don't know what they're talking about, they should just get over it and get into what's actually important. I don't think that's necessarily true. I think there are great ways to present information that 11, 12-year-olds, however young they may be, are able to digest. For me, I can come from the idea of I really struggled with math, and it wasn't from a place that I just didn't like it and didn't want to do it. I really didn't understand the concepts. But I was lucky enough that my education system in British Columbia actually worked with this, and they noticed that there was a problem. So they said, how can we adapt it to fit you? And taught me about things like mortgages, taught me about credit cards, taught me about all these different, interest systems and all of this. And that really worked for me, and that was math that I enjoyed, that I loved, and it didn't cut anything that was necessary. I still got to learn about algebra, but I got to learn ideas that actually made me passionate for learning.
Excellent stuff. Anyone else?
Can I just ask,
Yes.
I couldn't agree with you more about the straitjacket of the curriculum and teachers needing autonomy and be able to use their imagination. But there is one reason why you have a curriculum, even if the one we've got is very bad, is that not all teachers are inspiring and wonderful. And you need a curriculum that keeps the worst teachers up to a medium standard. You can't expect them all to be terrific. So, how free do you think teachers can really be to be spontaneous without actually...
I'm still listening. Okay.
Sorry, please.
So, that's a really great question, and that's kind of why we want to balance creating this week with still keeping a level of accountability over teachers. And I want to be really clear that when we're talking about accountability, we're not problematizing the idea of safeguarding or things like that. Those are incredibly necessary accountability mechanisms, but we can see here that most professions already have the accountability mechanisms that let them do their jobs safely and effectively. Teachers are 16% less likely than similar professions to say they have influence over their job, and that includes nurses, doctors, librarians, and lawyers who all work with vulnerable kids, and are all expected to produce measurable results. So there is kind of an extra level of accountability level on teachers that isn't actually necessary or effective. But I'd also like to point to the fact that it is still just 1 week. So teachers are still having this level of accountability, and we still are having this standardization across the rest of the year, albeit the idea of this cyclical nature of the curriculum, of being able to propose these policies, bring them up to the Department for Education, and then put them back into the national curriculum, will hopefully make the national curriculum more student-centered over time.
Well, I think that was very splendid. There's a lot of slides we never saw. They just shot by. But anyway,
I can send you the link.
Very, very impressive. Ladies and gentlemen, it's AJ and Kiara. Okay, we have a really eclectic mix of presentations for you this evening, and we're going to sort of change the mood a bit now. We're going to talk a little bit about gender-based violence. If I can invite Janvi Madak onto the stage. Janvi. Well, you know the drill. You've got 3 minutes, starting now.
Meet Alex and baby Iris. Alex was caught in an abusive relationship that left his body racked with burns and open wounds. His abuser became the first female in the UK to be convicted of a domestic abuse charge of coercive control in only 2019. Yet, many cases do not lead to a conviction, and many who are suffering struggle to access important services, like Mark, who shared that he could not access any resources anonymously after being sexually assaulted due to a language barrier and stigma. 1 in 6 men are sexually assaulted in the UK, but only about 7% of those cases are reported. 1 in 3 of all domestic victims are men, but still almost no safe beds are allocated to them. Abusers exploit patriarchal structures, telling men that their gender means that they won't be believed. Therefore, a gender-based approach to policy is corrosive. There are trans and non-binary individuals and even disabled communities that need specialist services that are barely existent. We know today that gender is fluid, but so much remains binary. How do we create policies that move towards victim and perpetrator and not men and women? Participatory Action-Based Research, or PAR, provides the framework for policy actors to directly access those falling through policy gaps. On-the-ground data of community stakeholders' lived experiences is combined with policy intervention. It is flexible and centers action. The community has power over analyzing the impact of current policy, identifying an issue, contributing to what can be done about it, and then analyzing the impact of that intervention. We could use a London borough to pilot this, for example. The first step is to launch a database that the government can use to track the process live. A trained research officer would liaise with the government and work with a community leader to conduct the PAR. Action-based learning is also embedded into the process, empowering the community to be knowledgeable and engage with the available resources, encouraging them to really reflect whether those resources are serving them. In the long term, this database can really be like an institutional fundamental change in how policy is thought about in the UK. If PAR is conducted nationwide, all this information can be held in the database, ultimately informing and briefings and laws. Establishing a framework means that during emergencies like COVID-19 or a sudden change in demographic, key data can be efficiently extrapolated. This method truly is for the most invisible. It has even been used in Australia with Indigenous communities. I'm sure there are communities that even I am not aware of today. With a power framework, we are putting the power back into the community and amplifying their voice with each passing day. Thank you.
Very good on timing. And I must say, the quality of the slides, I have to say, I don't know whether this is done in the previous rounds, but they're really excellent. So, Janvi, who'd like to ask a question on this?
Maybe I just ask a clarifying one to make sure I understood it well enough. Because can you just explain to us how the sort of database then relates to actual sort of action or intervention?
Yeah, sure.
Thank you.
So basically, there would be sort of a government leader and a research officer that would be on the ground in a community, an area that's defined. They would then collect the data, which is very different to cold hard numbers. It's a process that's been pioneered and used in many other countries where they collect the data of lived experiences of people. It could be, for example, about this policy gap, where there are about 0 refugee beds in London for men, very few specialist services. It really is, I mean, the strategy is called Violence Against Women and Girls, and there's sort of a footnote, well, there are men as well. But then there's obviously so many more people. So it would go into a community, let's say, for example, Tower Hamlets, which I could actually flip to that, and it's already been done in Tower Hamlets. This was done about poverty, and it ended up informing the Greater London area and issues about, and this was done for 6 years, about poverty. So what I'm saying is we need to institutionalize this, really make a database, define it nationally, each community, and sort of go in there and figure out what the policy gaps are, and then with the community, define the intervention, intervene, and then also track how those interventions play out. Yeah.
So, Mark, is it okay if I ask a question? So I suppose what I'm just trying to get my... First of all, thank you for identifying this as a specific issue, because it's important and it's often not recognised and talked about. So thank you, it's important. I suppose on that, I'm trying to work out, is it the participation action-based research that you think is a model that we could adopt in this area and might give us something otherwise we won't get? Or is it that you think we haven't sufficiently looked at this particular policy gap or policy area, and therefore you think that we should be thinking much more about either gender-based fluid people or men? I suppose it's which one it is, or are you trying to combine them both in a particular policy idea?
I'll just flip to a slide.
I love the fact this year everybody's ahead of us. I mean, this has never happened before. Maybe, I don't know, on the 10th anniversary, everybody at King's say...
It's gone crazy on the additional slides front.
Get ahead of the judges and go slide crazy. Go for it.
Currently in the UK, only 8% of the national budget is invested in analysing the impact of policies. Policies are kind of put out there, and we spend very little time and money analysing if these policies are working. So, sorry, do you have...
No.
Okay. For example, with this, we calculated that about £22 billion the government has to spend on sort of the mental health services and reporting of the numbers we know of male sexual assault survivors. So with having a database, I think it would help with this policy gap, but it could help with all policy gaps. I really would like that number from 8% being invested to increase, so we can really see, I think policies are dynamic, communities are dynamic, things change, and we really need a framework in this country for being able to understand if these policy interventions are working, how can we adjust them, and the community has to have a stake in that. Yeah.
Anyone else? Fantastic. Well, thank you very much indeed to Janvi. Thank you very much. Yes, the additional slides thing is really taken off. Anyone who hasn't got additional slides, well, useless. Right, number 4 now. If I could invite George Kincaid. There he is right behind me. George is going to talk about an MOT for your home. Yes, I know a lot of people are very excited about that idea. George, you have precisely 3 minutes, starting now.
I'll start with a riddle. What makes your energy bills higher, your home colder, and the planet hotter? Our buildings are leaking energy, through poor insulation and wasteful appliances. These buildings account for 1/5 of our national energy consumption. A staggering 60% do not meet energy efficiency standards, and a pitiful 1.8% are best in category. Tenants and homeowners, this means higher bills and colder toes. Citizens, this means needless fossil fuel consumption, rising fuel poverty, and a reliance on these friendly faces. We have the solutions. We could slash this energy by 30% with today's technology. So what's not working, and what is my proposal? Well, previous policies to retrofit our housing were axed after 2 years due to mismanagement and a low uptake in funding. In 2008, the government introduced energy performance certificates, EPCs, but these were designed in an era of cheap energy. They don't consider appliances, behaviors, nor tariffs, and being valid for 10 years, they do not effectively feed into markets or incentivize action. My solution is here, a home energy efficiency report, the equivalent of an MOT for your building or home. Here is broader than the current EPC, incorporating appliances, insulation, heat pumps, water, and energy tariffs. It would involve a regular home assessment by trained consultants designed to offer you a single standardized energy rating for your home behavior. Well, why change? Well, this is a behavioral problem. People are, well, people, beset by the gap between our intentions and our actions, and by access to information on how to make changes. A visible, color-coded certificate offering like-for-like neighborhood comparisons would provide social recognition for best performers alongside costed improvements. Well, is it feasible? Let's start in neighborhoods of high social comparison, large leaky buildings with owners that are less responsive to energy prices. Research suggests that neighborhood comparisons on energy bills can reduce consumption and increase sales of electric vehicles. An EPC rating of A or B in 2014 came with a house price premium of 5%, suggesting the market mechanism works. Well, is it acceptable? Here would be paid for by the building owner at a price similar to an MOT. But remember, the cheapest energy is the energy you don't use. Higher prices, and we could save on council taxes for the best performers, and vouchers and subsidies could be offered for efficient technologies. Finally, is it valuable? Here, regular building checkups, socially acknowledged certification, and consumer support for cost-effective home improvements introduces competitive dynamics into eco-friendly markets. We can accelerate towards a net zero world of higher bills, warmer toes, and a colder planet if we bring the future forward. The future's not out there, the future's here. Thank you.
You probably practiced that a few times. It's very, very good. Very, very good indeed. Almost dead on the 3 minutes.
Just about.
Who wants to go first? Polly.
We are facing something of a pushback on net zero at the moment, politically dangerous, being used as a cultural war weapon. What opposition to this would you fear you might meet?
Yeah, I suppose the opposition in terms of the initial upfront costs, so people feeling as though they need to pay for something that they already own, I could see as being an initial cost. However, the government has suggested that they're going to promote or going to put aside $6 billion for retrofitting housing. Now, my view is that there are 4 behavioral issues that this policy is trying to tackle.
Oh, we've got some additional slides. How lovely.
The first one is reducing information asymmetries. The second is harnessing the power of social norms, social pressure, and social proof. The third one is trying to make the right decision easy, reducing frictions for desirable behaviors. And the fourth one is increasing friction to inaction. Now, my suggestion is that the cost of this is currently an EPC costs about £40 or something above that. My suggestion, if this is a little more, it takes a bit more time, let's say it's double that, £60 to £150. Now, if you reduce the temperature on your boiler from 80 degrees to 60 degrees, and you adequately bleed your radiators, that can save 10 to 20% on your energy bill. Now, a £2,000 energy bill, that's somewhere around £200. You can make back that money in 1 year. Now, obviously, year on year, those are the low-hanging fruit, but year on year, You'll need to invest in other policies, but this is a mechanism of getting those policies and those behaviors into where we need it most, which is people in their houses. So I do see a bit of pushback. However, when people realize that the savings are there, and they realize that this is a social norm, this is something that we should be doing for everyone, then I see those setbacks subsiding somewhat.
Thank you very much.
Yep, David.
Can I go in? Thank you. Look, it's good to see if we can save the planet and warm up some homes. Can you just clarify a little bit? As you said, because it's quite close to an EPC in some ways. And it's also, do you literally mean annual? Because that's quite a big cost. And so how will you handle that for low-income groups that are already struggling? And maybe even, why not just get the EPC to work better, and particularly around house moves, would be an example, when behavior is disrupted?
Yeah, so this is about, that whole model, this is about it working better. I've suggested, for me personally, a rebranding, a repackaging would be beneficial because it promotes the more awareness. But to be honest, if they did these 3 things to the EPC, then I would be happy with that. I think there's 3 elements that need to happen. Firstly, it needs to be more frequent, so that the people are less likely to be inactive in their energy savings in their houses. The second thing is it needs to be broader. It needs to engage with people and their energy saving behavior in their house, and not just what comes out of the end of the meter reading. And thirdly, it needs to be more socially acknowledgeable. It needs to be visible. These elements to energy saving need to be a social norm, and how we do that, I think we make publicly visible your energy rating as a home. So those are my 3 kind of elements that make it different from an EPC. I like the idea of a rebranding. Obviously, then I can take some credit, but it doesn't need to be rebranded because the important thing is that the policy works.
Any other queries? Curveballs? Yes.
Yeah, just on that. So if it's going to be more frequent, who's going to be doing all these assessments? What's the infrastructure that we have to actually deliver this?
Yeah, so a book, Chris Skidmore has released a book recently on net zero, and he talks about these retrofitting hubs that are required. Now, to be clear, this needs to happen. If we are going to meet any of our climate targets, this is the lowest of low-hanging fruit to retrofit our housing and make sure our energy behavior is realigned. So I think part of that does fall on the government. That $6 billion that they're talking about, they can create these retrofitting hubs. They'll need restructuring skills, retraining, designing apprenticeships, and all of that can come. I'm not expecting this to be rolled out immediately across the whole country. I'm expecting it to be a localized effort to begin, and then as we see that, it will expand and expand and expand. It will include, we have a policy by 2035 to get rid of all gas boilers. We have an aim by 2035 to make sure every house has a heat pump. So this is a mechanism of making sure that those sort of policies can be engaged with. Now, BP in 2022 created windfall profits of nearly £30 billion. I don't think that's right. I think that businesses should take on some of the responsibility, because you wouldn't accept Coca-Cola getting windfall profits of 30 billion while they sell you Coca-Cola in a leaky bottle. And I think it's the same idea with these energy companies. And so that's what I'd like to see, them taking on some of the responsibility to roll this out and some of the cost as well.
Great.
Excellent. Well, number 4 in your song sheet, it's George, ladies and gentlemen. Right, please don't forget to just jot down your thoughts on each of them as they go by, because when you come to the crucial audience vote a bit later on, you need to, oh, I remember that one, that was brilliant, that was rubbish, whatever you want to say. Right, number 5, can I invite Bella Dave onto the stage? Bella, do come up. You're studying clinical research delivery, and you want us to include the dentist. Right. Well, let's see how you're going to achieve that. You have 3 minutes, starting now.
Okay. So, the International Conference for Harmonisation Good Clinical Practice Guidelines state that primary care practitioners should be informed of their patients' participation in a clinic.
Mark, I don't think your mic
is that microphone working?
Mic just needs a bit. We can't.
Sorry.
You might need to start again. It's not
yeah,
fair.
let's. Let's see if we... Is there somebody from... is that working? One. Yes, it is. It is. That's working. Maybe just stick it a bit higher up and just slightly louder, and that will work. Okay? We're going to start again. All right? 3 minutes starting now.
Okay. So, the International Conference for Harmonisation of Good Clinical Practice Guidelines states that primary care practitioners should be informed of their patients' participation in a clinical trial. So, it's standard practice for GPs to be sent clinical trial information when their patients are enrolled, and this is all part of reporting of harms. From 2014 to 2017, there are more than 150 deaths reported to be related to clinical trial treatments. So reporting of harms is actually really important, but also very challenging. So there have been guidelines developed, such as Consort Harms 2022, to help this. But is there anything else that we can do? Actually, there is. GPs are sent clinical trial information as standard, but there's no requirement for dentists. So the policy advocated is that dentists should be sent clinical trial information in the same manner as GPs. Now, this is important for various reasons. First of all, patient safety. Dentists make clinical decisions about patient treatments. From 2022 to 2023, there were nearly 2 million extractions performed on the NHS. And NHS dentistry actually has one of the highest activities of surgical interventions in the NHS. So could an experimental drug impact the outcome of this of this treatment? There are various drugs which can predispose to bleeding, which can predispose to infection. And sometimes the dose may need to be adjusted prior to dental treatment, or the dental treatment might need to be postponed or abandoned altogether. Then there are ethical considerations. If the dentist knows that the patient's on an experimental drug, then this can really help with the informed consent process. Then there are regulatory considerations. This policy is actually a very minor addition, but it can actually maximize the data gained from a clinical trial. A clinical trial of phase 3 cost in the region of $3 million to run. So the additional cost of sending out a few extra letters would actually be rather minuscule in comparison. These are the main stakeholders involved. We have the Health Research Authority, the Research Ethics Committee, and overarching them is the MHRA. Now, these bodies already have the processes in place to check that letters are being sent to the GP. It's not that difficult to extend that to the dentist as well. This could facilitate safety reporting and also potentially make the UK a more competitive place for running clinical trials. Now, lastly, I'd just like you to consider this scenario. Imagine you have cancer, and the only hope for survival is an experimental drug as part of a clinical trial. Now imagine that you're on the trial and you break your tooth when you're eating breakfast. Don't you want your dentist to know that you're on this drug, that there could be an increased risk of bleeding or infection? It's trying to bridge the gap and fill the clinical trial cavity.
Very good. How many seconds? Your timing was so brilliant. That whistle was literally almost on her lips. So fantastic on the timing. And I must say, what an interesting little gap in our sort of medical treatment that I knew nothing about. Anyway, who'd like to ask questions? Go on then, Bobby.
No, I mean, look...
We were just tapping the table.
Oh, yeah, no, that was amazing and so clear, so clearly put across as here's a gap. We hadn't really thought about it. I mean, it's astounding to me that there's 2 million extractions a year. Is that what you were saying?
Yes, nearly 2 million.
Nearly 2 million extractions. I thought I was bad with my teeth. I thought I was unusual, but that's...
It's not just one person. I think it's a lot of people.
Not just one, yeah, several, spread across several people. But I think it's a no-brainer, isn't it? Why hasn't it happened to date?
To be honest, I think I've identified this because I have the background of dentistry, I have the background of working in clinical trials, so that's why I've been able to identify it. But to be honest, I just don't think it's on anybody's radar, and that's why it hasn't come up. It's been really difficult to find any data about quantification of harms from dental treatment whilst patients are on experimental drugs, because it just isn't there. People aren't looking for it. They might not even know that the patient's on a drug.
Wow.
So,
well done in identifying that gap. That's amazing. Thank you.
Have dentists ever talked about this? Are they worried about it themselves?
Well, when I have approached dentists to talk to them about it, yes, there has been. So, for example...
So there's frustration out there, but they don't sort of mention it to people?
No, they don't.
Perhaps they should have done.
Anecdotally, as I said, they are worried because every dentist I've spoken to would like to know if their patient was on an experimental drug.
Yeah.
I've had to ring patients up at times to tell them, look, we've got this patient, they're one of yours, you've planned some treatment, they're on this drug, can you tell me more about what you're doing? And the panic on the other end of the phone is tangible because they haven't planned for this at all. It's prepped up on them and it's a bit of a shock.
David.
How interesting.
I was just going to check. So, in government, the argument would be, well, for how much extra effort and what would be the scale? Maybe you can just bring it to life. So, presumably there'll be lots of other non-experimental drugs that people will be on, which could increase the risk of bleeding, lots of more routine treatment. So, presumably that needs to be sorted out, and maybe it is already, versus, how many people have died? What would the dentist do different? I'm just trying to work out the cost-benefit analysis before you start sending out thousands or millions of letters. Help it.
Yeah, that's the thing, the data just isn't there. So, but why would you wait for something to happen? Why would you want to spend lots of money collecting data? Because if you're that patient that it happens to, then it's a really significant event and you have to look at other things like time off work and, health costs. But doing the cost effectiveness analysis would be useful to do, but then you're collecting data, you are waiting for something to happen. That's what you're doing, rather than troubleshooting and preventing someone from getting hurt.
Yeah.
I think you've convinced the judges, actually, Bella. I don't, you need to say no more. Ladies and gentlemen, Bella, thank you very much. Yeah, fascinating, absolutely fascinating presentation. Thank you very much indeed for that. Just two more to go. If I can invite a trio now. We've got Isabella Childs, Tara Imalingat, and Tolu Fadarin. Come on the stage. And you're going to apparently confront waste colonialism through student agency. I'm going to be fascinated to know what that means. You have 3 minutes to explain all, starting now.
We buy more clothes in the UK than any other European country. And whilst many of us donate unwanted clothing to charity shops, 70% of these donated items are exported to the global south. This makes the UK the second largest exporter of textile waste in the world. What we choose not to see is the devastating impact on recipient countries. This photo behind me shows a landfill in Accra, Ghana, where 15 million items of clothing arrive each week for processing. 40% of these items are unusable, burned on the outskirts of the city due to overflowing landfills. This burden of waste waste management is a clear case of social and environmental injustice, and it is perpetuating a trend of ill health, poverty, and environmental degradation. This is waste colonialism, when one group uses waste and pollution to dominate another in their homeland. Current initiatives to tackle the problem are UK-centric and uncoordinated, particularly at the university level. As students at King's, we believe this is where we can make an immediate and effective impact.
We propose a university-wide initiative to cultivate fashion circularity and reduce the quantity of textile waste being exported from the UK. To do this, we will set up clothing donation boxes across campuses and student residences, offering convenient drop-off points to dispose of unwanted clothes. Students will be employed to sift through donated items to identify which garments are suitable for sale in second-hand pop-up shops or upcycling in student-run fashion events. Materials deemed unfit for use will be directed to recycling companies like Roberts Recycling, where discarded garments will be transformed into new products. This policy will be implemented through the Students Organizing for Sustainability, an organization affiliated with the National Union of Students, which will enable us to coordinate across over 70 UK universities and create a cohesive response to waste colonialism. When we thought about what image would convey the success of our policy, we joked that it would be the image of a clean beach. And in our case, this would be quite literal.
There's a clear gap here. And whilst there are many desperate to fill it, our current conversations and habits of blind donation are simply ineffective. Through this initiative, we are not only reducing the amount of textile waste exported from the UK, but we're further creating a culture of intentional circularity. Thoughtful donation through the lens of decolonization and care for the individuals who suffer at the hands of our good deeds. Extending the life of one garment by 9 months can reduce carbon, waste, and water footprint by up to 30%. When you consider the fact that there are up to 3 million students in the United Kingdom, the magnitude of the potential impact of this policy is momentous. I'll leave you with this. One man's trash is not another man's treasure. It is time we utilize our collective agency as young individuals and take ownership of the damage we perpetuate in the Global South. Thank you.
Very nice. It's a lot harder doing it as a trio, I think. So you did really, really, really well. And a fascinating subject as well. Who wants to start? Yes, Louise.
So, first of all, thank you so much, and what a brilliant presentation, actually, and a fantastic use of slides and information, so thank you, and very uplifting, it has to be said, and very practical, which of course appeals to me enormously. So, why is this new, and why isn't this already happening?
The thing is, it's not new, right? So there's a lot of people who want to confront this. The UK has audits about, environmental sustainability. We see, several institutions, universities who care about this. But the problem is, there's this, you think of the term greenwashing, where we don't quite think about the impact that we have, outside of the UK borders. So there's this idea that if you donate your clothes to the charity shops, we've done a good thing. We don't see it in the UK's landfills. But it's a bit counterproductive, because if you're degrading the environment elsewhere, I mean, it affects all of us, right? And we should care about that. And so it's sort of happening, but like we said, it's not quite cohesive, and it lacks that wider picture of the impact we have globally.
And do you think in particular that students are, I mean, you clearly do, so I guess you chose students because it's a community that is in particular places. Do you think that ambition is big enough, and that you should be thinking about outside students as well? Why isn't everybody thinking about doing this, and why has no huge charity in the UK adopted it? You're going to say yes, Louise, that's a great idea, but you know what I mean? I'm just wondering whether you're pitching at the right level, being practical.
Yeah, I think that we are being quite practical. I think we understand there's student communities across the country and also globally. We do believe that this could be expanded. It might take a life of its own, but what we're saying is we have access to over 3 million students. The infrastructure already exists. No one is doing this. Universities are already doing different initiatives in isolation. Why not work together? Why not come together as students? And if it works, let's implement it in different countries, even in the Global South. Yeah. Let's collaborate across different countries and figure out how to, as students, as young people, as the people who buy these clothes, let's figure out a way to contribute to the solution.
And as students, we are creators of culture, and there is such a large number of us, and we are one of the biggest consumers of clothing. So it is a great place to start for sure, and it makes sense, yeah.
I like it for precisely that reason, that you've started at a level that's manageable.
Yes.
You haven't started by saying, I'm going to get hold of the minister and make them change their policy. It's something that seems doable. Students are people who might be most amenable to it in the first place. So how do you kickstart this to get it all around campuses everywhere?
Yeah, so actually...
We have extra slides.
Do you have a slide? I was getting worried there, actually.
Yeah, we do. So I guess through the NUS, who have a network of, like Tara said, over 70 universities, and on their website they say up to 4 million students that they are sort of in contact with. And so they have the Students Organizing for Sustainability, and within that there's Green Impact, another initiative that we could sort of initiate the program through. And it is very feasible because there are so many, it's such a core issue because all these universities already have these sustainability related societies and sustainable fashion societies. So collaborating with them and through the student unions, it would be
quite a feasible way to
Yeah, I mean, as intelligent as we all are, we're all quite easily influenced as well. And so we have this added benefit of our social media networks, our social networks talking to one another, where we create a culture where we say, hey, we're putting on a fashion show, and we'll have a speaker, we'll talk about why this is important and why we're doing this, but we're also making it quite cool and kind of adding to this culture that does already exist of secondhand shopping and thrift shopping and upcycling. So there's quite a niche that we very easily fit into, and I think that we can definitely capitalize on.
All done? Well, I love your enthusiasm. Absolutely fantastic. Thank you very much indeed to Isabella, Tara, and to Colin. Right, it's the time for the last of our 7 pitches now. If I can invite Isaac Ing onto the stage. Hi, Isaac.
Hi.
And you're going to talk about transforming child health with social prescribing.
Yep.
You know the form. 3 minutes starting now.
We are facing an epidemic amongst children, not from infections, but non-communicable diseases. Currently, 1 in 5 kids are suffering from mental health issues, obesity rates are doubling from reception year to year 2, and it's causing diabetes and cardiovascular diseases and much more. The pandemic has unfortunately made things even worse by encouraging unhealthy behaviors such as excessive eating and social withdrawal, costing the NHS billions. Consider the case of Tom, a child who has an increasing BMI. He misses the threshold for obesity treatment, hence receives no support from the reactive health screening program. Because of that, he gets bullied and can't concentrate in class, leading to a drop in grades and feeling alone and isolated. The lack of a national mental health screening program means that his issues are not picked up by any healthcare professionals, causing him down in a spiral of excessive eating and depression. As you can see, our current healthcare system is narrow, reactive, and fragmented. And so it's causing so many kids to fall through the cracks. Amidst of all the chaos, social prescribing serves as a beacon of hope. It's an established and effective intervention which connects patients to activities, groups, and services in their community. Rather than intervening after disease onset, my policy today is to move it earlier before unhealthy behaviors solidify, creating a national social prescribing program in UK primary schools. So, what does it entail? Well, first of all, after the current health screening program that exists, every single child, regardless of their health status, will have a one-to-one session with a licensed social prescriber who's going to go deep into their concerns and understand more about their social determinants of health. Afterwards, the prescriber is going to coach them on healthy behaviors and also organize school interventions and community support for them. Depending on the child's interests and what they enjoy, this may include joining basketball competitions, additional PE lessons, going to the park with their friends, or even just community hiking. It depends on what matters to the children. Finally, we're going to have annual follow-ups for every single child to ensure that we're having continuous monitoring and tracking them. Why is this policy special then? Well, first of all, it's a singular policy that tackles all types of NCDs. As we know, these diseases are linked. Once we tackle one of them, it creates a toppling effect which will improve the holistic health of the child. Surprisingly, social prescribing has also been linked to an increase in academic attendance and engagement and results, which is certainly good news for all the parents and all the schools out there. Our timing is also impeccable. By intervening before disease onset, we're fostering sustainable health behaviors, which by Barnardo's report recently has been evidenced to have an 80% return of investments. To summarize my entire policy, I think it's good to use the health behavioral model. We're increasing a child's capability by improving their psychological resilience, giving them someone, a social prescriber, to rely on. By bridging the social gaps and streamlining referral services to local organizations and adjusting school environments, we're creating equal opportunities for all children, regardless of their background. Finally, our collaborative approach ensures that we're doing what matters and what motivates the child, fostering sustainable change for decades to come. So, let's play it forward for a healthier future. Thank you.
Thank you very much indeed, Isaac. David, are you motivated? Are you capable? Have you got opportunity now?
So I think it's really interesting to try and think about the primary drivers of ill health, including, actually you live in a social world and so on, to move upstream. So I think it's really, really laudable. I guess one of the challenges might be, isn't this what life should be like for kids anyway. Shouldn't we be connecting kids? And so maybe talk a bit more about that, because you're saying, are we doing it for everyone? Or, do you know what I mean? Are we inadvertently almost medicalizing what should be a part of a normal life to connect and do vibrant outside activities?
Okay, so this is a really good question. One of the good things about social prescribing that it's not medicalizing anyone, because we're prescribing activities for them, which is, as you mentioned, what all kids should be doing. However, because of the pandemic, as I mentioned, there are lots of ingrained unhealthy behaviors that children are just not getting off. And because their parents might be busy working, they don't really know that they shouldn't be, continuing down this path, such as excessive eating in Tom's case. And so by creating opportunities and giving someone there to analyze what they're doing in their life, telling them that, you might benefit from joining basketball competitions because you can meet new friends, you can get your cardiovascular system more healthier, and also it's just a happy thing to do. By telling them to do this, children are more motivated to do these sorts of things, and this will cause a positive outcome. So yes, I do believe that this kind of policy should not only be in children, but also, in adolescents and expanding in different age groups. But if we want to scale it step by step, we should start with the best time of intervention, which is primary school children.
Right?
So
Yes, Louise.
you're thinking it would be a universal policy that is applied to every child at primary school?
Yes, so the idea is that we should have a national policy which is centrally regulated and updated to the highest of standards in order for all primary children to undergo this. However, I do understand the difficulty, especially motivating stakeholders, such as the NHS or even service providers. That's why I have a really good scaling program for us to sort of expand the scope and widen age groups. So first of all, obviously we need a seed fund, but it depends on how small it is. We then measure the uptake, adherence, the health trends, and also the academic improvements, which is really important for some schools.
So Isaac, sorry, I'm not wanting you to use more slides. Honestly, I understand entirely, and I'm sure you have a plan. I suppose what, somebody that worries about how much the taxpayer has to pay for things, just to put it in sort of the reality as we head into life is pretty tough out there for many, many people. I guess I would need to be convinced that you would use a model of social prescribing for every single primary school child, when I think there's maybe some primary school age children that don't need me to pay for you to provide social prescribing. So sorry, I'm asking a tough question of the last person, but it's the kind of thing that you would be asked if you wanted to actually get this policy up and running anywhere. So is it universal for everyone? Is it targeted? Why would we put money into what seems to me like good teaching and good parenting?
Okay. So I do understand the concern, especially when obviously we're spending lots of billions of dollars in the NHS. I think it's a balance between different values. So do we want to cut costs at every single corner, but risk not having equal opportunities for all children? How are we there? How are we able to confidently identify the children who don't need this policy and those who need it? Yes. Are we even eligible to do that in the first place? And so I personally believe that, yes, it's a lot of money, but if we look at the outcomes with an 80% ROI, and also obesity, for example, costing the wider economy currently in 58 billion, which is an updated statistic, I believe that it's something that we need to go forward to. It's difficult, it might be challenging, but in a few years' time, we will see the difference, and that's what I wanted to happen.
Well done, that's good.
Well, a very neat little homily to end on. Isaac King, everybody, thank you. Well done, Isaac. Well done. Right, well, we've now seen all 7 contenders for the glittering prize that is Policy Idol 2024. Thank you to all of our contestants. I have to say, really, really high quality of presentation this year. And I'm slightly disappointed that our trapdoor didn't get an opportunity to dunk one of them in our vat of humiliation, but never mind. Now, in a moment, the judging panel will be conferring and consulting, convening and conversing. policy prestigiosis in action, essentially. But before we do that, as I said at the beginning, we are celebrating this year the 10th anniversary, the tin anniversary of Policy Idol. In a moment, Bobby's going to talk a little bit about those 10 years. But before I invite him up, we're going to now look at a video which tells you a little bit about the journey that Policy Idol has been. That's not right? No. No. Yeah, Bobby, you take over.
I've not, am I? Yes, yes. No, I'm just going to, I don't want to keep people from the judging and from the drinking, so I'm just going to say a very quick thank you to people before the video. And that's what
Bobby, do your thank yous.
Yeah, so all I wanted to do, and I won't keep you long, is just to celebrate this 10th year by thanking all the people who helped set this up. For it. So the people who established it, Jonathan Grant, as director of the Policy Institute, established it, but also Jennifer Rubin. I don't know where Jennifer's. Is Jen here?
She sent her husband.
She sent David. Sarah Rawlings.
Hey.
Yay! Yay! Sarah Rawlings is here. Ross Powell is here too. Ross is one of our amazing people who takes all of that great work on communication skills that you see demonstrated so well by the students, by Ross, and a teams of mentors who have seen these students through from the Policy Institute over the years, as well as the communications team who put together this amazing event and have also put together the amazing video that you're going to see soon. So massive thank you to all of the team at Policy Institute who have done this over the years. A near final thanks to Mark Easton, who has been absolute constant throughout this. And has created so much of the culture and approach to this. It is down to Mark's brilliance at doing these types of events. So thank you so much, Mark. And then final thanks is, of course, to the students over the years who have had amazing impact on us. We always say this is the most delightful process that we have at the Policy Institute overall. Every year we say that, and it's always true. This night and all the run up to it is the best thing that we do. So thank you so much to all the students who we're going to hear from some from the past when we play the video now.
Right. Yes. Am I allowed to? I just want to introduce the video. Yes. 10 years of Policy Idol. I've been here for every single one. It gets better every year. This is the best year we've ever seen, honestly. But you can look back at some of the former years now and some of the highs and upper highs that we've never had a low throughout the 10 years. So, ladies and gentlemen, the video.
Staying in academia, going on to do a postdoctoral research placement, and instead I did none of those things and I went into policy as a job. So I've been working, following Policy Idol, I did the King's Parliamentary Research Internship, which is also organised by the Policy Institute and Careers at King's. I worked with Baroness Bennett during that experience, and then I stayed on in her team, hired directly by her, and I now work for a learned society in the infectious disease space, who fund one of my days a week is in Baroness Bennett's office, as well as in the office of Julian Sturdy MP. So it completely changed, Policy Idol completely changed my career path from sort of lab-based science into policy.
After finishing my master's degree, upon my return to Paraguay, my country, I engaged in my community and in the Chevening Alumni Association, spreading awareness on climate change policy, which was part of my proposal, and led the Paraguayan team on a climate change hackathon for the COP26. Policy Idol was clearly my door to dream of making a contribution and the world a better place.
There were so many things I learned while participating in Policy Idol. The primary being what it took to take an idea to design and to final pitch, and during that process what it meant to take this policy, rip it apart, figure out where the holes were, not only to just answer the questions on it or make sure you understand what you're talking about, but also to really understand and make sure that your policy is one that's right for the problem that you're addressing.
I think that the experience overall made me confident in public speaking, awareness raising of a niche area that affected a small but significant group of the population, as well as influencing change at system level in terms of the system-wide buy-in from the recommendations that I had.
The highlight of taking part in the Policy Idol competition in 2019 when I did it was getting to meet and understand the world in which senior policymakers lived. It was not something that I was familiar with at all. Again, as a lab scientist, I was very used to my bacteria, very used to my reagents, very used to doing science at the coalface. But I had never really considered how what we did in the lab translated into policy and obviously later practice. And getting to meet some of these quite prolific policymakers who were judging the competition was really excellent.
There's so many highlights from the Policy Idol competition, from Julia Gillard telling us that we've done an amazing job, to Louise Casey telling us as soon as we finished our pitch that she loved a three-pronged plan. But I think for me, my highlight was right after the heat rounds, when we had just pitched for the first time. We had just received the initial feedback and we had just left the building. We took this slightly uncomfortable looking selfie right outside the building, and you can just see how excited and proud we are knowing that we had something good here.
That was really lovely. It was really nice to see some of those faces. From bacteria to policymakers. I mean, what a journey, eh? Right, it's time now to get down to the difficult business of judging. Our quartet of judges will go off to a secret room in the dark, and will be making their, probably over there with a bottle of wine actually, but they'll be doing that. You also need to start thinking about your votes for the coveted audience prize. As I said, you need to follow the web link on the card on your tables. I think, do we have a slide? No, we don't, but anyway, I'm sure you'll be able to manage. If you are having trouble, just ask one of the Institute people, they'll help you out. You've got half an hour or so to gather your thoughts, accept any bribes or inducements that you need to from the contestants, and I'll see you back in half an hour. Good luck. Okay, everyone, the judges are beginning to convene over there. They've been released from their quarantine. I can tell you that their minds have been made up. Your votes have also been counted. So if you'd like to return to the international display of snacks, and we'll come to the results momentarily.
I'll be here because I've got to give out.
Oh, yeah, yeah.
Move in one.
Ladies and gentlemen, we are but moments away from learning who are the winners of Policy Idol 2024. Bobby has joined me here to present the prizes. We have, as you know, 4 prizes. We have style, we have substance, we have your own brilliant audience prize, and then we have the overall winner. There is money attached to these prizes. Not insignificant money. So for style and substance, and indeed your prize, 250 smackers. Not too bad. Quite a lot of, yeah. Whoop, holla, yeah, why not? And for the overall winner, the Policy Idol winner 2024, £1,000. Wow! Just think of the kind of in-depth research project that you could buy for £1,000. It's difficult to imagine. Right. So our first winner is, this is the prize for style. And after much deliberation, I can tell you that the winner is a presentation on helping students choose what they learn. It's AJ and Kiara! Many congratulations to AJ and Kiara. We move straight on, though. The second prize is the winner for substance. And I can tell you that this was a presentation on enhancing health literacy is Renalini Day. Well done. Fantastic presentations. Right, now it's what you voted for, the audience prize. Which pitch was the most persuasive in the room tonight? And I can tell you that the winner of 250 smackers for a presentation entitled Targeting Waste Colonialism, it's Isabella Tarantino! Keep it going. Very well done. Very well done. Right. Now the moment we have all been waiting for, the announcement of the overall winner of Policy Idol 2024. I think we need a little drum roll. Can you help me with that? The overall champion tonight, with a presentation on targeting waste colonialism, is not only Isabella Tarantino! The most unconvincing check I've ever seen. Anyway, Well done, well done. Yeah, trophy. Well done. Absolutely fantastic. Now, take your check, if you go. Many congratulations to, I think, a worthy winner. And in fact, I have to say, I think all the presentations tonight were absolutely superb. And the fact that there are a few that didn't win a prize at the end of the day is not to say that they weren't brilliant in their own way. And I'm sure that many of those ideas may well go on. There's certainly a couple that I thought should do. I'd now like to invite King's College's Vice President, Robin McIver, to say a few words about tonight's splendid event. Robin McIver.
Thank you, Mark, and good evening, everybody. I'm Robin McIver. I'm here representing our Vice-Chancellor, Kshitij Kapoor, who does send his apologies. But what an event tonight has been. Absolutely infectious, full of energy and great ideas. And as somebody who, I suspect, like many people in the room, tends to watch a bit too much news and current affairs and sometimes can feel a little bit weighed down by that, what an antidote this is. With the great ideas and the enthusiasm that we've heard tonight. So I've got the nicest job of the evening just to wrap things up with a few closing remarks. So here they are. So across the globe, people in local government, in central government, in the media, in business, in social enterprise are hungry for fresh ideas. They need talented and insightful graduates with strong analytical and critical thinking skills, with passion, with wisdom, and with an inquisitive mindset. Policy Idol is the way that we nurture those characteristics here at King's by supporting the development of the next generation of leaders and offering them incredible opportunities beyond classroom learning. And whilst it's a special occasion every year, as you've been hearing, this is the 10th anniversary. And just worth noting the incredible numbers that are attached to this event. So since 2015, there have been 800 people who've gone across this stage and had some form of recognition through this process. They've gone on to make a difference in a whole range of sectors and walks of life. And the video that you saw earlier just caught a snapshot of the impact that this program is happening. I'd like to recognize the really hard work of everybody in the room and those behind the scenes. Each team, each individual student who's taken part has devoted their time and their energy, and we really saw that earlier on during the presentations. 7 contestants or contestant teams made it to the final tonight, as you know, but we had 75 entries this year, which just goes to show you that this is really taking root across the university. Tonight's finalists came from 4 different faculties, bringing together different strengths and approaches to solving some of the big issues that are facing society today. And Policy Idol really does exemplify our approach for integrated and interdisciplinary work here at King's. So thank you, everybody. Thank you for the amazing presentations. You delivered them with real clarity and confidence. And actually, I said to somebody during the break, with a sense of fearlessness, right? Standing up here with a highly celebrated panel and some tough questions, right? And some pretty robust answers. So I commend you all for how you've conducted yourselves this evening. It's been really, really impressive. So thank you all. Thank you to the Policy Institute team. Thank you to the judges. Thank you to Mark for comparing so expertly. Thanks to you all for giving up your time to make it a success. Next year, of course, will be number 11. I look forward to seeing many of you there. But in the meantime, I hope you've taken a bit of inspiration out of the process, out of what you've seen here tonight, from the conversations that you've had and what you've had to listen and absorb. It's all in service of making the world a better place. That's what we try to do here at King's. It can sound a little bit cliched, a little bit anodyne at times. I think moments like this are when it really turns into something meaningful. So thank you again. Many congratulations to everybody, and we'll see you next year.
Thank you very much indeed, Robin, and Policy Idol is almost at a close. If I could add my thanks to all of our idols, a truly fantastic display of talent tonight, and to our judges who achieved the nigh on impossible task of actually ranking such a varied range of ideas and pitches. Thank you to all of you for some really top-class whooping and some pretty good hollering as well. And for the hard work that you put in to find our audience winner. I would ask that all the finalists stay, I think, standard procedure. If you could come up to the stage for a few photos at the end. But to all the rest of you, it's been, as ever, it's been a really inspiring and rather wonderful evening. Farewell, have a safe journey home. Thanks very much for making Policy Idol 2024 such a great event. Good night.